A lot of people, they're walking around, they have their glasses on, or they're squinting constantly trying to get those contact lenses in their eyes. They don't have to live like that. People like Nancy Balin from Balin Eye and Laser Center can help them out. So many people, though, they still wear the contacts, they still wear the glasses. What causes individuals to need corrective lenses in the first place?
Well, that's a really good question. And basically, people need corrective lenses if they're nearsighted or myopic, or farsighted or hyperopic, or have astigmatism. So nearsightedness or myopia is either caused when the eye is too long or has a very steep cornea, and where the cornea is in the front of the eye. And farsightedness, on the other hand, is when the eye is shorter and the cornea might be flatter. Astigmatism is when the cornea actually is curved more like a football rather than a baseball. And so it can distort the images. And so the most common correction for any of those, so with LASIK we make a flap in the cornea, the flap is pulled back, then the excimer laser is used to reshape the cornea, and then the flap is put back, and then the flap just heals itself naturally.
How do you know if you're a good candidate for vision surgery, and how do you figure out which treatment is best for you?
Well, most people who go within the parameters of either a certain degree of nearsightedness, farsightedness, and astigmatism are candidates for the surgery. People actually need to come in to get checked to make sure that they don't have any other issues, such as an irregular distortion of the cornea, or a condition called keratoconus, or abnormal thinning of the cornea, or a cornea that might be too thin. And those are things that we check prior to considering them for refractive surgery and for LASIK.
Yep.
Very often patients come in with issues with their glasses. The glasses are too heavy, they give them headaches, they hurt them at the bows, they're inconvenient for sports, skiing, tennis, swimming. They can't see to at the beach with their children and go swimming, so people want to get rid of their glasses. And the same with contacts. You can't swim with contacts. Actually, there's a high incidence of allergies to contact lenses. People get dry eyes as they get older, and the contacts become very uncomfortable, and that's actually very, very common. And also the risks of infection with contact lenses. So for all these reasons and for convenience, many people come in and decide to get LASIK.
Dr. Balin, let's talk about different surgeries that are available today when people have corrective lens issues.
Well, the two laser surgeries that are available, one is called PRK, and the other is LASIK. And PRK is an earlier surgery that we used to do and occasionally will do. It's a surgery where we don't make a flap in the cornea, but we do the laser on the surface of the cornea. And the benefit of that is if someone has a thinner cornea, we can do the surgery. But most people prefer LASIK because the recovery of vision is much quicker with LASIK. PRK actually takes several weeks for the vision to come back. In addition to that, there are other ways to correct vision. LASIK will correct nearsightedness, farsightedness, and astigmatism, but if you are over 45 and need reading glasses, that's a condition called presbyopia. And the cause of that doesn't have anything to do with the curve of the cornea. It actually has to do with the muscle inside the eye, which doesn't work as well, and so people have to start holding the reading material further out. So LASIK doesn't correct that, and right now the only way we actually have to correct that with LASIK would potentially be monovision, where we will correct one eye for distance and one eye for near, or a multifocal intraocular lens implant, which we can use in conjunction with someone who has cataracts and needs cataract surgery, and for some people who just want to have what's called refractive lensectomy, where the lens is removed and a multifocal intraocular lens implant is placed. Well, a cataract is actually a clouding of the lens in the eye, and the problem with cataracts is that they start to cause blurred vision. So if a person starts to have difficulty with their vision, where they notice they can't read letters on television anymore, or when they're driving at night they start to have some glare or halo, or disability in their everyday life, then they have developed a visually significant cataract. And the way that we treat that is we remove the cataract, which is the lens, and we have to put an artificial implant in. And nowadays we have a few choices of different types of implants. We have an implant that will actually correct astigmatism, And then we have an implant that will correct both distance vision as well as reading vision, which is a multifocal implant.
Let's talk about what happens after surgery, recovery time, and how people are feeling.
Well, the recovery time for LASIK is actually fairly quick. They have the surgery on a particular day, and the next day most people are legal to drive. You usually are using medicated eye drops for about 2 weeks, and I usually have people on artificial tears for maybe about a month. For cataract surgery, it's actually quite similar. The recovery of vision is within a few days after the surgery, and the same thing, drops are used for about a month for that as well.
So it's easy, it's outpatient-esque almost.
It is, it's all outpatient.
Talk to me about insurance. Do they cover what needs to be covered when it comes to LASIK surgery?
Well, for LASIK, usually most insurances don't pay, although there are some insurances that do cover parts of LASIK. And we do participate with a lot of those insurance companies. And cataract surgery is usually a covered service by insurance, although depending on the type of intraocular lens implant, some of those are not covered.
Let's talk about the safety of procedures like this.
Well, it's really important to pick an ophthalmologist that's had experience. You want someone who will do a comprehensive eye examination to make sure the person is a good candidate for LASIK. It's important to have excellent and state-of-the-art technology and someone who's had a proven track record. Many people are motivated to reduce their dependence on glasses or contact lenses, and if that's the case, it's so much easier to wake up in the morning and be able to see without having to reach for your glasses or put contact lenses in and take them out at night. And so there's a big freedom with not being dependent on glasses.